In today's video, we're going to talk about the Part D Medicare changes. We're going to talk about 5 important changes coming for Medicare Part D. So let's get right into it. So why do we even have to talk about changes when it comes to Medicare Part D, and what is Medicare Part D? So Medicare Part D is for your prescription drug coverage. Medications that's prescribed by your doctor is covered under Medicare Part D. And the reason why we have to go over these changes because of the Inflation Reduction Act. That was a law that helped reduce the cost of medications, okay? So the max out of pocket for medications is $8,000, okay? For individuals that spend a lot on medications, now it's going to be reduced to $2,000. Because of this, there is a lot of changes within Medicare Part D. So let's get right into it. Let's talk about change number 1, okay? So change number 1 is your deductible. So what is a deductible? Your deductible is the amount that you have to pay before the health insurance pays. So your deductible can be up to $590 for the year. So if you have a deductible, then you have to pay this $590 before the insurance carrier actually pays. Now it does depend on the tier and the class of your medication if you even have to meet a deductible, okay? So if you're taking medications on tier 1, tier 2, the higher the tier, the higher the medication will cost, okay? Usually you can have medications in classification of tier 1 to 5 or even tier 1 to tier 6, okay? So if you're taking tier medications 3, 4, 5, and 6, then you may have to meet that deductible. If you're taking medications in tier 1 or 2, and you may not have to meet a deductible at all, okay? So keep that in mind. It does depend on the tier of your medications if you actually have to meet that deductible, okay? So yeah, the deductible is set at up to $590 for the year. So let's talk about the second thing that we want to talk about when it comes to prescription drug coverage Medicare Part D. So just because the medications is now capped at $2,000, and this is actually not a change, this has always been in place, but we do want to make sure you understand this. Just because the medications is capped at $2,000 does not mean that all medications will be covered, okay? So the medication must be in the plan's formulary to be at the $2,000 max. So if you're taking a medication and it's not in the plan's formulary, then most likely you will pay the full price for that medication, okay? So it does not count towards the $2,000 max, okay? However, if you are taking a medication that is not in the plan's formulary, then your doctor can reach out to your insurance carrier and let them know that this medication is medically necessary. And the insurance carrier may have you go through step therapy, try this first, try that first. But sometimes you can get that medication approved and then it will be counted towards that $2,000 max if the insurance carrier does in fact approve that medication and do an exception for your particular case. However, like I said, if the medication is not in the plan's formulary, then it is not counted towards that $2,000 max out of pocket. Alrighty, so let's talk about the third change, and we pretty much touch base on this, and it's just simply that now the medications is going to be capped at $2,000. Like we said before, the medications was capped at $8,000. So let's break this down further. First, we're going to talk about Medicare Advantage plans, and we're going to talk about standalone drug plans, okay? First, let's talk about Medicare Advantage plans. So a lot of individuals have Part D included in their Medicare Advantage plans. So it's going to be very important for you to look at the changes when it comes to your plan. Look at the changes when it comes to your medications, and not just your medications, okay? this is actually going to affect your plans overall. Why is that? That $6,000 that you're no longer responsible for, someone has to pay for that. And that someone is going to be all Medicare beneficiaries, is going to be insurance companies as well, and pharmaceutical companies as well. Medicare Advantage plan is going to eat most of the costs, meaning that they're going to have to look at their plans overall and cut back. That makes perfect sense, right? So if they have to eat up $6,000 worth of medications, then they're going to change up some of your benefits. So it's very important to look at your plan for 2025. Look at this letter that you should have received from the insurance company, which is the A.N.O.C letter, the Annual Notice of Change. This will break down and outline the difference from your plan year to the next year, okay? So look at that. It's going to show you what are your plan benefits now and what are your plan benefits for next year. Look at your co-payment visits for your primary care doctor, your specialist, hospital stay days. Look at your overall benefits, dental, vision, hearing, your specialist visits, your co-pays for your medications. You're going to want to look at your plan overall and look at the changes within your plan. Do you want to keep your plan for next year, or do you want to go ahead and change to another Medicare Advantage plan? It's going to be very important that this year you do a thorough plan review when it comes to your Medicare Advantage plan. Now let's talk about the standalone Part D plans. These are your Part D standalone plan, meaning that you probably have a Medicare supplement plan along with original Medicare, and you have a drug plan as well. It's going to be very important to look at your drug plan for this year. So you want to look at it and say, hey, can I afford this monthly premium? You also want to look at your medications. What tier are you on? Is that medication still a $0 copay or a $5 copay or whatever you was paying before? What is your new copay moving forward? How much am I going to actually pay for this particular drug plan? You're also going to get a A.N.O.C letter as well. So it's going to be very important to look at your letter as well. And if you need to make changes, then you definitely want to do this during the annual enrollment period. So yes, it's going to be very important for everyone to do a plan review for next year. And just in case you did not know, the annual enrollment period is between October 15th to December 7th. If you make any changes within that period, then the new plan will start January the 1st in the following year. Alrighty, so now we're going to talk about the fourth change, and we pretty much touch base on this, but we're going to repeat it again to make sure that you really understand. The fourth change is most likely if you're on a standalone drug plan, the monthly premium will increase. You definitely want to know what is your monthly premium and what are the new co-pays for your medications. The last thing you want to do is to go pick up your medications in January and to find out that you no longer can afford that medication, okay? Just because you did not read your A.N.O.C letter or you just did not know. So it's very important to understand the changes and that changes are definitely coming your way. Alrighty, so now we're going to talk about the fifth change, and this is also known as M3P, okay? So what is M3P? Medicare is coming out with a brand new prescription payment plan, okay? Now, this prescription payment plan is going to be optional. So if you are, in fact, taking expensive medications, then it may be worthwhile to look into this and enroll into this new payment plan. So what is this? What is this all about? So basically, if you're taking expensive medications, like I said, you can enroll in this new prescription payment plan. And what's going to happen is that Medicare is going to allow you to spread out your payments throughout the year. This is going to help you manage these high cost medications, okay? Now, it's not going to give you a discount or anything like that. It's not a discount program. It's just going to allow you to spread out these payments throughout the year and help you manage your medication drug costs, okay? So if you're already on medications, that's tier 1, tier 2, you're paying $0 copay or $5 copay for your medications, then there's no need to enroll in this prescription payment plan. It's designed for individuals that spend a lot, hundreds and hundreds of dollars on medications. So if you're at that end where, yes, you're going to be paying $1,500 to $2,000 for your medications throughout the year, then you may want to go ahead and enroll in the program. So this is how it's going to work. Instead of paying copays at the pharmacy, you would make your monthly payments to the insurance carrier to this new prescription payment plan program. So that's how that's going to work. You would not pay copays whatsoever when it comes to the pharmacy. You would just make your monthly payments to the insurance carrier. So that's how that will work. So in today's video, we talked about the 5 changes that's coming out when it comes to Medicare Part D. I hope you learned a lot in today's video. If you have any questions, comments, concerns, leave them in the comment section below, and I'll be more than happy to answer your questions. Thank you so much for watching, and I'll see you on the next one.